The purpose of our center is to bring together health scientists from diverse disciplines who have a common interest in studying the prevention and management of chronic diseases. But we're interested in more than just generating knowledge. We want to take that knowledge, develop it into innovations that can then be disseminated and implemented into communities across BC, Canada, and worldwide.
Our lab is trying to develop, test, and optimize exercise and nutrition interventions for people with metabolic disease. Primarily, we're focused on type 2 diabetes. And we know that what you eat and how you move is going to be beneficial to not only prevent those diseases, but also to treat them. And some of the work we're doing right now even potentially put type 2 diabetes into remission.
The focus of our research very broadly is nutrition and metabolism. And more specifically, we focus on human energy balance. So that's the food we eat and the calories we burn. We're trying to understand and characterize different aspects of energy balance so we can ultimately inform better recommendations and interventions with people, particularly those with chronic disease.
The overarching aims of my research is really to improve the long-term health and well-being of people who have had a stroke, and I do this in two research pillars. The first research pillar focuses on clinical research, where I look to work with people who have had a stroke and improve their chronic disease self-management. And the second research pillar is health services, where I look at the uses of technology for the delivery of health and rehabilitation.
Impact is a primary goal and a fundamental value within our center. In order for that research to have an impact, we need to make sure that that research addresses the values, the needs, and the preferences of people living with chronic conditions.
Obviously, researchers are the experts at research, but they've never had the condition that they're studying. Only the patient partner has the lived experience, and it's best to bring those two perspectives together.
Working with participants is definitely the most rewarding aspect of research. I'm very grateful for their willingness to participate in our studies and ultimately in their trust that what we are studying may have important implications on informing evidence-based best practices in stroke care.
I'm very proud to say that we are the first Faculty of Medicine center established outside of the Lower Mainland. There are so many advantages to being located in the Okanagan. You can't have impact unless you're connected with your community, and by virtue of our location, we're able to create those connections and to have that impact.